Hey, Mr. Robinson. Looks like you're in some pain again. Tell you what, let me go get you some more pain medication, okay? Looks like you pulled your IV out, didn't you? Well, that's all right. I'll get you fixed up. Tell you what, I'll be back in a couple of minutes. We'll take care of this for you.
Well, that was a relatively calm reaction by the nurse. Perhaps it was the first time this patient had pulled his IV out. And not to pick on this nurse, but how many of us have felt or thought about reacting in the way you're about to see?
Hey, Mr. Robinson. Looks like you're experiencing some pain again. Tell you what, I'll go get you some more pain medication, okay? Look what you did. Pulled your IV out. Why did you do that? You know that stops the flow of the medication, don't you? I'll be right back.
Wow, these situations can be very tough. But what can we do? You're about to see one technique on how to handle a particular situation. But keep in mind, it's only one technique. The guiding principle here is anticipation. And what can we anticipate? You know what to anticipate. You know what these patients do to things that irritate them, that agitate them. They pull them out, they try to get rid of them. But if you can expect it, then you can plan for it.
Mr. Robinson's resting comfortably now, and I gave him about 2 milligrams of morphine earlier, but the only thing is we're anticipating, I should say, that he's going to possibly pull out his IV when he wakes up. So there's a couple of tricks of the trade that I can show you that'll help that out a little bit. First one is we're going to wrap the IV, or we're going to hide it essentially. Get that out of there. The second thing we will do is we will also tape what they call a decoy to that arm over there. That way, hopefully, when he wakes up, he will go for that instead of this. And if he pulls that one out, it also won't hurt him, which is obviously important. Last thing we'll do as well is we'll go ahead and we'll hide this after I get finished wrapping his arm. That way when he wakes up, he won't see it, and it'll cut down on the agitation. Okay. Sometimes when patients see their IV lines, it causes more agitation than what's necessary. So
sort of out of sight, out of mind.
There you go, exactly. Okay. Yeah, you got it. So I'm going to go ahead and wrap this about up to his sleeve, and then once that's done, we'll go ahead and tape the decoy over there on that arm. That looks good. All right, I'm just going to tuck that right down by his side. Make sure he's comfy. Let's go ahead and put that IV, that decoy IV right there. There you go. And I'll get you a couple pieces of tape.
So just down here?
Mm-hmm. Yeah, actually just a little higher. There you go, perfect. I want to make sure we put it in a comfortable place that's as unobtrusive as possible.
All right.
There we go, one more. Good deal. And then as I mentioned before, we're going to make sure that the IV line is hidden behind his pillow here. That way when he wakes up, he won't see it, and hopefully that'll keep him calm.
Got it.
And there you go.